Welcome to This Explainer. Today, we're looking at something deeply profound, yet totally ordinary, the everyday sensory experiences of children. Take a moment to settle in as we explore Dr. Winnie Dunn's sensory processing framework. We're going to do this with a lot of empathy, patience, and honestly, a whole new level of understanding for the little ones in our lives.
So picture this. You see a child absolutely melting down in a busy grocery store. Or maybe they're just completely refusing to wear a specific pair of socks. Our first instinct is usually to label it as defiance, right? Or just bad behavior. But consider this for a second. Is it a tantrum? Or is their sensory cup just overflowing? Today I want to invite you to reconsider those daily frustrations. What if they aren't being difficult at all? What if they're literally just overwhelmed?
To really wrap our heads around this, let's use the sensory cup metaphor. Think of sensory input like the noise of a crowded room, the glare of bright lights, the scratch of a clothing tag, or even the smell of lunch as water. Every single child has a sensory cup that needs to be filled for them to feel just right and engaged with the world. But here's the catch. Not all cups are the same size. Some kids have a massive, huge cup. You can pour and pour sensory experiences into it and it barely even registers. Other kids, they have a tiny, delicate little teacup. It only takes a few drops of water, a sudden loud noise, a scratchy seam, and bam, that cup is completely overflowing. A child's sensory system needs to be full, but absolutely not spilling over.
Okay, let's dive into this, because there is some fascinating science behind our cup analogy, all rooted in Dr. Winnie Dunn's sensory processing framework. The scientific term for the size of that cup is the neurological threshold. Basically, this is the exact point at which there is enough sensory input to actually activate the central nervous system and cause a response. It's a purely biological construct. It's governed by a complex balance of excitation and inhibition in the brain. So it's not a choice the child is making, it's just how their nervous system is naturally wired.
Let's contrast these two experiences. A child with a low threshold has that tiny cup. Their brain responds to a stimulus super quickly. They notice the soft hum of a refrigerator, the faint smell of perfume, or the flicker of a fluorescent light almost instantly. Their system is highly excitable. On the flip side, a child with a high threshold has the huge cup. Their brain has a much slower response to stimuli. They actually need intense, prolonged, or completely novel stimulation just to trigger a neural firing. They might completely miss cues that everyone else in the room notices easily, like someone calling their name or even having food smeared on their face.
And this brilliantly illustrates the core of Dr. Dunn's model. The framework takes that neurological threshold, our vertical axis going from low to high, and intersects it with a horizontal axis called self-regulation. Self-regulation is essentially what the child does about the sensory input. It ranges from passive, meaning they just let things happen and react internally, to active, where they proactively do something to change their sensory environment. When we cross these two axes, we get 4 completely distinct sensory processing profiles. So let's break them down one by one.
First up, we have sensory sensitivity. This child has a low threshold, the tiny cup, combined with a passive regulation strategy. Imagine tiny ink droplets of noise, bright lights, and new textures falling rapidly into their little cup. These kids notice absolutely everything, but they don't actively try to escape the noise or the lights. Instead, they stay right there and react. As those droplets start to reach the brim of their cup, they become easily distracted, highly anxious, irritable, or really short-tempered. They are absorbing it all, and man, it's exhausting for them.
Next is sensory avoiding. This is also a low threshold, tiny cup scenario, but this time it's paired with an active strategy. When the water hits the brim, these children actually take action to stop the flow. Think of a child transitioning from a quiet, calm home into a chaotic summer picnic or a vibrant, buzzing new classroom. The cup completely spills over. You'll see them actively covering their ears, hiding under tables, establishing super rigid routines, or outright refusing a new texture of food. When that cup overflows, remember, it's not defiance. It's a meltdown because they've lost total control and are actively trying to escape an overwhelming, genuinely painful neurological input.
Now, let's move to the bottom half of the model, the huge cup. The first of these is low registration. This is a high threshold paired with a passive strategy. These children basically miss the water entirely. They might appear disconnected, lethargic, or kind of apathetic. Because their brain just isn't registering the environment, they might ignore their name being called, have a highly unusual pain tolerance, or sit there with messy clothes without even noticing. And here's the thing, they aren't ignoring you on purpose. The sensory input simply hasn't breached their massive threshold to activate their attention. The final quadrant is sensation seeking. This child has that massive, high-threshold cup, but they use an active strategy. Their brain needs a ton of input, so they go out and get it. They are constantly moving, crashing into furniture, touching everyone, chewing on their pencils, or craving incredibly intense flavors. Unfortunately, these are the kids frequently labeled as behavior problems in the classroom. They're seen as impulsive or disruptive, when in reality, they're literally just actively trying to fill their massive cups with enough stimulation to finally feel just right and regulated in their own bodies.
So the absolutely crucial point here, the big paradigm shift, is this. Sensory assessment works best when behavior is treated as information, not defiance. When a child throws themselves on the floor at the mall, or chews a hole in their shirt, or seems to just ignore you from across the room, we have to look past the behavior itself. The behavior is just a signal. It is vital, crucial information telling us about an overwhelmed or severely understimulated nervous system. Let's move on and see how this builds into real-world application, looking at how caregivers and educators can adapt everyday routines. For example, for a child with sensitivity who is avoiding morning routines, we need to reduce the input. Think tagless clothes, warm wipes, a highly predictable structure. For a child who is sensation-seeking during a boring bath routine, we actually amplify the input, maybe using highly scented soaps and a fun visual schedule to engage them. If a child is overwhelmed by mixed textures at mealtime, caregivers can use step-by-step graded exposure to slowly desensitize them. It's all about matching the environment to the specific size of the child's cup to keep it from spilling.
Bringing this all together, here are some incredibly practical takeaways. First off, be a sensory detective. Observe closely. Look for the spill. If you see a child wrapping themselves tightly in a blanket or retreating to a calm corner, respect that. Reduce the input for them. Soften the lights. Use quiet cues. Also, try breaking daunting tasks into smaller step-by-step parts so their cup doesn't fill up all at once. And above all, stay calm and patient. Remember, they aren't being difficult. They're navigating a world that often feels entirely mismatched to their neurobiology. We've covered a lot of fascinating ground today, looking at how the nervous system and behavior intertwine in our daily lives. So I want to leave you with this final lingering thought. How can you change the environment today to better support the sensory cups of the children in your life? Whether it's swapping out a buzzing fluorescent light bulb, allowing an extra movement break, or honestly just offering a little extra grace when things do spill over, it all makes a difference. Thank you for joining me for this explainer, and I really hope this compassionate lens brings a little more peace and understanding to your daily routines.